Bismillahirrahmanirrahim. So the topic of our discussion today is nephrotic versus nephritic syndromes. Both the nephrotic and nephritic syndromes are actually renal diseases which are derived from the glomerular inflammation. The glomerular inflammation in nephrotic and nephritic syndrome occurs due to formation of immune complexes which damage the glomeruli resulting in glomerulonephritis. So these immune complexes can either be formed in situ, which means there is an extrinsic antigen which attracts the antibodies forming antibody-antigen complex or also known as immune complex. Then there is anti-glomerular antibodies which are autoantibodies and identify a specific protein as an antigen and forms antigen-antibody complex. Then there are circulating immune complexes which are preformed antigen-antibody complexes which get trapped in the glomeruli. So all these immune complexes ultimately result in recruitment of white blood cells through releasing certain inflammatory mediators resulting in inflammation. So this inflammation ultimately leads to damage of the glomeruli resulting in glomerulonephritis. The cellular mediators of inflammation in this case include neutrophils, monocytes, lymphocytes and macrophages as well. These soluble mediators are also known to play the part in glomerulonephritis, which are nitric oxide, endothelin, cytokines and chemokines. Coming on towards the sign and symptoms, proteinuria is a typical feature present in both nephritic and nephrotic syndromes. In the nephritic syndrome, proteinuria is typically less than 3.5 grams per day, whereas in nephrotic syndrome, proteinuria is higher than 3.5 grams per day. Hematuria means presence of blood in the urine. Oliguria means decreased urinary output. Azotemia means increased blood urea nitrogen. Localized edema such as periorbital edema is also common in nephritic syndrome, which occurs due to decreased osmotic pressure, since the protein loss through the urine is increased. This shifts the fluid from intravascular compartment to extravascular compartment, resulting in edema. Hypertension occurs due to decreased GFR, which activates the renin-angiotensin system, elevating the blood pressure. Hyperlipidemia is a typical feature of nephrotic syndrome. Coagulation disorders can also occur in the nephrotic syndrome, which are due to the excretion of clotting factors. Hypoalbuminemia is due to excessive excretion of proteins. Edema is also a feature of nephrotic syndrome. Opportunistic infections are also common in the nephrotic syndrome, which occur due to decreased immunity due to the excretion of antibodies. The most common diseases that are part of the nephritic syndrome include acute proliferating glomerulonephritis and rapidly progressive glomerulonephritis. Nephritic syndrome can also be a result of a systemic disease such as systemic lupus erythematosus and microscopic polyangiitis. Nephrotic syndromes include membranous nephropathy, minimal change disease, focal segmental sclerosis, membranoproliferative glomerulonephritis, and IgA nephropathy. Both nephrotic and nephritic syndromes are identified clinically. Then there is protein in the urine, blood urea nitrogen, and the definite diagnosis is always based on histopathology. Treatment of all kinds of the nephrotic syndromes as well as the nephritic syndrome is with the immunosuppressive agents such as steroids. So this concludes the section nephritic versus the nephrotic syndromes. We will discuss each of these diseases separately. If you have any questions, do let us know in the comment section. Thank you.